Hello, I am Dr. Madhan Thiruvengada. I am a senior orthopedic consultant in Apollo Hospital, and I specialize in sports injury and joint replacement. I do complex procedures on various joints. This is my specialty, and this is Lucian Phillips, is one of my patients. Today we are going to talk about the knee and young adults who are having knee problem as well. I will leave it with Lucian to talk about more about his problem and how he came to me and how it was addressed. Lucian, would you let know what is the problem before you came and see me?
Yeah, so about a year ago, I was having complaints on my right knee after having multiple practices of soccer after school. The pain kept getting worse and worse. I went to a few doctors and they would tell me to do some stretches, or it was just growth problems. And then I came to Dr. Madhan, and we took an MRI scan and we saw that there was an issue on the lateral side.
Basically, Lucian had a problem with his knee, mostly on the lateral side of his knee. He's a student from international school. He studies in American school, I believe. Yeah, he's from Peru actually. He's a good soccer player. So his passion is to play soccer without any discomfort in his knee. Because he had been to different people and he had tried some exercises which didn't help him a lot. So he came and saw me. So when I examined his knee, so basically what he had is a knee joint pain mostly on the lateral side. This side of the knee was hurting him, and he could hear some clicks as well, I believe. Yeah. So that was his main complaint. So when you go about joint pain in young adult like him, so what we can think of mostly with this kind of problem is a meniscus problem on examination of clinically. Go into more details of it. We did an MRI scan. Obviously, it proved to be a meniscus problem. It's a peculiar problem which happens in few young age adults like him. This is a model of the knee joint, as you can see. This is a femur, and this is a cartilage bit of it. And this is what we call as a meniscus. So meniscus is a C-shaped structures which is on the tibial side. This is a tibia bone. So it's got two meniscus. One is medial side and this is lateral side. You see the bone, this is a fibula. So this is the lateral side of the meniscus. That is why he had the problem on this side. So if you can closely see inside this, as I said, it's a C-shaped one. So both sides are C-shaped one, and this is a ACL. This is called anterior cruciate ligament. So in this condition, what happened is, instead of being a C-shaped one, because of the developmental anomaly, he had what we call as a discoid meniscus. Discoid meniscus is nothing but it's a rounded and fully not demarcated meniscus. So there's no any dip inside it. So only when you got a dip where the knee moves in, so you can glide in. So if you don't have a dip, it's a fully blown meniscus, then it doesn't glide like that. So then it slips and he's got a problem. So this is what he had a problem on. So in order to address this, mostly discoid meniscus, we can treat it non-operative and operative as well. But operation was chosen for him because he had a problem and discomfort mainly, and he couldn't go back to his playing soccer. So I offered him an arthroscopic procedure, which we did it last year. What I did in arthroscopic procedure is a keyhole procedure. So as you can see in his knee joint as well, so it's just a tiny hole. Hardly you can see any holes in that knee joint. So I went in, and as the meniscus was discoid, as you can see in this MRA as well, where you can see a rounded meniscus instead of a C-shaped formation. So I trimmed the meniscus and made it as a C-shaped. So in order to glide it smoothly. So it's mostly done as a day case procedure. As you can see in this arthroscopic pictures as well, there's a shaving of the meniscus has been done, and how smoothly it is now post-operatively. After this, his stay in the hospital was hardly a day. I planned to discharge on the same day as well. But for various other reasons, he planned to stay for one day longer. And we had a good rehabilitation. So how was it after the surgery, Lucian?
Before the surgery, like I said again, I kept having a lot of clicks and a lot of pain on the lateral side of the knee. But after the surgery, the first few days I was on crutches. I couldn't put much weight on it. But then as I progressed and did the stretches that my doctor told me, I started getting better, and then I was able to walk and then slowly run to the point where I was playing soccer back to normal. And then after practice, I wasn't having any pain, and yeah, I was playing well.
So you've been into professional football, isn't it? From your school, you've
Yeah.
been in school time, school team. So no other issues now, right now.
No issues right now.
Your father told me you went for the soccer
Yeah, I had a
tournament on that.
I had a soccer tournament in February, which I was able to attend, thankfully.
Good. That is all about what we call as a discoid meniscus, especially pain in the young age people. Thank you.